Ghana has recorded 2 more cases of MPOX. A statement from the Ghana Health Service reads, stating that the National Public Health and Reference Laboratory has confirmed 2 more additional cases of MPOX, 1 in the Greater Accra region and 1 in the Western region, bringing the total number of confirmed cases to 4 as of today, the 18th of May 2025. The statement continues that preliminary assessments indicate that these 2 newly confirmed cases have no epidemiological link to the earlier reported cases. The government of Ghana remains committed to safeguarding public health, it assures, and it concludes with a statement that drawing on our experience in managing similar outbreaks, we will continue to implement appropriate measures to protect the health and well-being of all residents. Now, for more on this, we've been joined by Dr. Oliver Kome, who is the director of Ghana Center for Infectious Diseases. Doc, thank you very much for joining us on Journey's Prime today. I mean, give us a little more updates on what has been recorded as far as the MPOX disease is concerned.
So, good evening and thank you very much. Like the press release said earlier, we recorded 2 new cases. And I must say that these cases are not linked to any of the previous cases. Another one in the Greater Accra region, and 1 also in the Western region. All these cases are separate and not linked epidemiologically from the previous cases. I must also add that the case in the Western region is currently on admission and doing very well. The case in Accra is mild, so it's currently at home, and we are monitoring on OPD basis.
Doc, in terms of preventive measures, what can the public do to, to try avoid contacting this disease?
So remember that we've been saying that monkeypox is a contact disease. You need to come into contact with the fluid from one of the rashes that an infected person has. If anybody hasn't got monkeypox or there's no rash, characteristic rash, you will not be exposed to monkeypox. The key thing is that we do not know who has monkeypox or not until the rashes have come out. Sometimes we touch different objects that we don't know who touched earlier on. So the key thing will be the general population. The best we can do is to continuously wash our hands with soap and water, hand hygiene, and also for anybody who has a rash for which there's no explanation for, with a fever, please report to the hospital, and then we will see you in the hospital. As much as possible, if you have a rash, we will say you should cover that rash. Maybe wear a long sleeve, wear trousers, so that if anybody is sitting close to you, maybe in public transport, that person will not be infected. As much as possible, if you have a rash you are not too sure of, try as much as possible not to mix up with other people. That is also important. All of us need to be each other's keeper in times like this. We do not need to panic because we have handled monkeypox and most of our cases have been mild. None have passed on so far. So the general population just needs to relax, just follow the lay-down procedure. Once you have a rash, make sure you cover that rash if you have to even get to the hospital. Thank you.
And Doc, just finally though, talk to me about the risk involved for the general public, especially for the individuals who have contacted this disease so far.
So I must say that almost all the people who are infected at the moment, those who have contact, we have linked up with their contact. We are following up with their contact. At the moment, none of their contacts is showing any symptoms or signs of the disease. So we all need to just relax and we'll keep updating the populace about what is happening.